people come in and complain of a lot of vein problems. And vein problems, they're kind of divided up into two, actually three different varieties. One is strictly cosmetic, and those are the spider veins that aggravate everybody, make you not want to wear shorts in the summer and that kind of thing. Those are a cosmetic problem. The second are varicose veins, and those are the big veins that you can see. They hurt, they can thrombose, which means clot. They can break and bleed like crazy. They can cause ulcers, skin problems, skin discoloration, those kind of things. Those are actually need medical treatment. Then there's deep vein problems, and deep vein problems are usually associated with some kind of trauma, deep vein thrombosis, something that's happened to the deep vein that makes it not work properly. That's a more difficult problem. The problems that we can actively treat are the spider veins, which what I do for those, if it's small clusters, we use a laser on them. If it's more than that, what we do is a thing called sclerotherapy, where we take a sclerosant and we inject those veins, and then your body comes in and gets rid of them. We do that here in the office. It's a cosmetic procedure, takes 30 minutes to an hour, it's pretty quick. Recovery times are relatively short, and the success rate is really good. For varicose veins, those, for insurance to cover those, which insurance will, but we have to jump through some hoops, and that means they have to be symptomatic. We have to ultrasound them to illustrate that there's a significant problem there, and then there's a period of stocking time that you have to wear. But once you go through those things, insurance will take care of those. The way we used to treat them was by stripping. Now what we do, in a way that I learned over 10 years ago from the guy who brought it here, was I use endovenous laser ablation. And what that means is, instead of stripping the vein out of there, actually removing the vein, what we do is we remove it from the system by putting a small laser fiber up into the vein, and then we heat seal it. And that's a procedure that we do here in the office. We use some sedation, and it works extremely well. And recovery times on that are really good as well.